evening on Facebook. I know it's a Monday night. It's a little later than I normally get off, but it's been crazy. I've had a number of wild and crazy events happen in regards to just seeing the challenge of switching over to telemedicine from face-to-face visits and trying to make sure all that works well has been a challenge. I don't know if it's been that way for you in doing telemedicine from home or telework from home. But hope you are having a good evening. Hope all is going well. In Arizona, it's a little crazy here. We've had 1,100 patients with coronavirus as of today, with 20 deaths. And I know that the numbers have been skyrocketing across the country and across the world with lots of changes. Today, our Governor Ducey, just enacted a stay-at-home order, expanded what we had already been doing a little further. Still left the stores open and the essential jobs functioning, but they're still, I guess, going to define that further. If you are new to the broadcast, let me know. Put a new in the chat box or a one in the chat box. Let me know where you're from. And so as I'm doing charts here, my wife is making dinner in the background. You may hear her, and you may hear my animals. You may see cats run by. You may see dogs bark, or hear dogs bark. Anyway, I thought I would talk about something in regards to what does it mean. Let me see if I can find the title here. Maybe I'll find it. It might show up. There it is. What does it mean to moderate protein? I thought I wrote this in here. Mean to moderate protein. So I'm going to put it in anyway. All right, there we go. So put this in as a title. A lot of people get confused. They've read my book. They've seen me on the website. They've looked at how do I start this keto thing? What do I do? And I'm confused by what it means to moderate protein. They did the protein calculations and they said, that's just not enough calories. I'm going to die. All sorts of things like that. So let's talk about that a little bit. Let me explain. I put a couple lists here in regards to the keto basics. And so what's the basics? Well, basic number one is you want to keep the total carbohydrates less than 20 grams per day. We've talked about that and what that means in many cases. And I won't go into that heavily because most people understand that concept. Well, I assume they understand that concept. We've had to teach people how to wash their hands and tell them not to eat Tide Pods. So less than 20 grams of total carbs is the answer there. Go back and watch some of my other videos and we'll talk about what that means. Second step is a protein to fat ratio of 1:1. Now, what that means by grams is what that essentially means. So the big challenge is this. we cut the carbs to less than 20 grams per day. And then for every gram of protein, you should roughly use a gram of fat. Now, this is a starting point. I tell people you calculate. There's a couple of protein calculators around on the internet. You can use mine. You can use a number of them around there. If you're a female, it's usually about 1.2 grams per kilogram of body weight. It's for men, it's 1.6, 1.8. Depends. I use a protein calculator based on height because it's easy to do. And so you can find that on my website. If you go to the blog and type in protein calculator, or if you go into my book, you can find it in my book. Those are all ways you can look to calculate protein to fat. The reason is, let's take an egg, for example. An egg is 7 grams of protein and 7 grams of fat. It's essentially a perfect food. And what that means is that if you eat an egg and you calculate the calories from that egg, not that I think the calorie is important, but if you calculate the actual calorie, that puts your ratio of 30% protein and 70% fat in one egg. And bacon is the same way. Red meat is the same way. Most pork is the same way now. Red meat and pork will fluctuate a little bit in regards to the total fat. It'll fluctuate somewhere between 65 and 75% fat, and somewhere between 25 to 35% protein. It does, over a day or two, that's what matters, not that specific meal. But the big issue that we want to look at is if we can get close to 30% of your calories are coming from protein generally, and 70% from fat, you're pretty much ketogenic most of the time, if that's what you're doing. And we'll talk about things that can kick you out here in a minute, but the key is starting there. Now, I've had some people that are 5 foot and they come into me and they calculate the protein and they say, well, Dr. Nally, that means I'm supposed to eat 50 grams of protein and 50 grams of fat if we ballpark their height and their physical activity level. And they go, well, that's like 800, 900 calories. How can I live off that? Well, remember, that's a starting point. Many of the women that I see don't even eat near that enough protein because they're afraid of it. because it has fat with it, and there's still this phobia about it. And so I use that calculator for women, especially to help encourage them to increase the protein levels to where they need to be. Because without protein, you're going to see hair loss, you're going to see fatigue, you're going to see muscle aches, you're going to see you won't see weight loss because the body thinks it's starving. And there's a number of other things you can see when you're protein malnourished. From the perspective of men, most men eat enormous amounts of protein. And if you're insulin resistant, meaning you overproduce 10 to 20 times the insulin in response to those foods that stimulate insulin, remember that the 10 essential amino acids, 3 of them actually stimulate an insulin response. And so let's say you're 450 pounds and you produce 30 times the normal amount of insulin because of the obesity and how the fat cells respond to insulin stimulus, a piece of protein can actually halt weight loss in those patients that are severely insulin resistant. Now, the interesting thing is that as you lose weight and as we bring that insulin resistance down and you begin to lose weight, your insulin resistance level becomes less and less and less. And what we find is that initially we're doing higher fat, 70% fat and 30% protein. And as we get you closer and closer to normal, we can actually increase the protein to maybe 40% and decrease the fat to 60, and then even 50 to 50. And so when you get to be up into the bodybuilder range, we're often using more protein to maintain muscle mass and a little bit less fat based on hunger and exercise needs. And so no one ever talks about this concept of the shift that needs to occur because of severe insulin resistance over here and normal insulin response here. And that protein need will need to go up and the fat need will come down over time. It's never addressed because no one really understands it. That's the problem. And most people in the exercise world say, "Oh, high protein, low fat," and that's all they talk about. And they argue that until their faces turn blue. Yet those patients that I see that weigh 450 pounds, if we don't get their fat up and modulate their protein, they'll actually have trouble losing weight beyond 20 or 30 pounds, and they'll plateau out and they'll get discouraged, and their cholesterol will stay high, and they won't understand what's going on. So initially, it's high fat and moderated protein. As we move closer, that protein level will go up. Now, let's say I had a patient that came in and she said, "Dr. Nally, I'm always hungry at that 1-to-1 ratio if you calculate my protein." Well, when you start talking to her, she's under a lot of stress. She doesn't get as much adequate sleep as she needs to, and she's more physically active than we thought, and than we thought she would be. That's important to understand that she actually needs more protein and more fat. And it's not that we raise the protein, it's that we raise the protein and fat together. And I apologize about the sound behind me. It sounds like the kitchen is working hard to make dinner. So I apologize about the clanging dishes and stuff if it's annoying you. Anyway, so that's the story. So hopefully that's clear. Hopefully that's clear to you. Now, next step is important, and I just want to give this as a caveat. Don't drink your calories. Stop drinking them. This is not a ketogenic diet that's properly designed is not one that you're slathered in fat. It really isn't. And for some reason, people get that impression that, you slather everything in butter, you bathe in butter, you eat butter, you drink butter, and you put butter in your coffee. If you want to put butter in your coffee, fine. But realize that if you're putting liquid fat onto food that's already 30% protein and 70% fat, it may slow your weight loss because that fat content, it doesn't, when you become very fat adapted and you absorb fat very efficiently, if your body has more fuel in the bloodstream, it slows the release of fat from the fat cells. They're still cycled, but it slows it down. So your ability to lose fat goes down. So if you're doing, if you suddenly push that to 80 and 90% fat, and you're not horrendously insulin resistant, then you may actually see that excess fat from fat bombs, fat in your coffee, slow that weight down too much. Now, remember, a high fat diet is any diet that's higher than 30% fat. We're talking about 70% fat. So even if I lower your fat intake to 50% fat and 50% protein, it's still a high fat diet. A lot of people don't get that concept. It's a concept that you need to understand. A 1-to-1 ratio by grams is 30% protein and 70% fat for the most part. It's a ballpark calculation. But again, if people will follow ballpark calculations because it's easy to do. But if I make you count your calories and count your protein and count your carbs with every single meal for the next 3 months, you'll do it for 3 weeks and then you'll stop and you'll fall off the wagon and you won't come back and see me. So key, lower the carbs total to less than 20 grams. Protein 1-to-1, protein to fat 1-to-1 ratio by grams. Don't drink your calories. And lastly, avoid foods that spike insulin. Now, I've seen some people that I respect say, "Oh, that insulin spike is worthless. It's not nothing to worry about." Let me back up. I've been practicing medicine for 20 years. I've been doing ketogenic diets for 16 years with patients. With myself, we see anywhere between 10,000 and 13,000 patient visits per year. The majority of those patients, 85 to 90% of those patients, we're checking blood work every 3 to 6 months, and I'm watching closely insulin levels, cholesterol levels, thyroid levels every quarter with these patients, very, very closely. I can tell you that when your insulin spikes, and what I mean by a spike is, let's say you decide I'm going to have bread 2 or 3 times a week, and just that extra roll is okay. If you're insulin resistant, that spike of insulin is enough to halt your weight loss literally for the next 4 days. And if you cheat twice a week, you won't lose any weight. If you're using foods that spike insulin, excessive amounts of protein, if you're really insulin resistant, and I'm not talking about those that are moderately, because they can actually handle more protein as time goes on. If you're using sweeteners, and I wrote a whole free page on sweeteners, go to docmuscles.com, check out my website, click on the freebies and go to the sweetener page, and I'll tell you which sweeteners are okay and which ones aren't. Most of the sweeteners that are out there, most of the sweeteners in the keto foods, there are very few keto foods that are keto friendly. I went to a keto conference recently with hundreds of vendors and walked through hundreds of vendors of keto friendly food. I personally could only eat 3 of the products of these hundreds of vendors with multiple products, because they all had sweeteners that spike my insulin and literally cause my cholesterol to go up, raise my blood pressure, cause me to retain water, and halt weight loss, or cause me to become more bloated and uncomfortable. And it does it to you as well, and I know it does, because you've been in my office and I've seen you do it. So that's the important part to understand, is that, so sweeteners that do it, leaf-based teas that come from a tree, green tea, black tea, oolong tea. I've written about this in my book. We've talked about this in other programs. They raise insulin. And what I'm finding is that with a number of my patients, even soy lecithin and sunflower lecithin causes an insulin response in some people. And there's a bunch of low-carb ketogenic friendly bars out there that contain soy or sunflower lecithin. These halt my weight loss. They halt patients who are horribly insulin resistant. It causes their weight loss to slow down as well. So the challenge that you have to understand is that if you truly want to see weight loss, you need to understand how to lower the carbs, how to balance out the protein, realize that you're going to be higher fat, lower moderated protein initially, and then it's going to slowly bring that down to where the fat levels drop a little bit and the protein comes up as you gain muscle and lose fat. Avoid foods that spike your insulin, and don't drink your carbs. So I've rambled now long enough. I'm assuming that most of you are probably going, "Oh my word, Dr. Nally, can you just stop and answer our questions?" So let's answer some questions. All right. Frank says, "No cheating. You just derail your medical goals." Yes, you do. So what if you eat lower the fat and meat? So what if you eat lower the fat if the meat is a 1-to-1 ratio? I'm not quite sure I understand your question, Linda. Maybe you can clarify what you mean by that. So pork, eggs, red meat, they're already 1-to-1 in their ratios. Chicken, fish, and turkey are lower in fat. And so if you're losing weight and you're using lower fat and higher protein, great, stick with it, because that means you're not as insulin resistant as many of the people that come in my office. I hope that answers your question. I'm not totally sure if it does or doesn't. Let's see here. Melanie says she agrees 100%. Hello all from Dan. Let's see, that's me stuck at 25 pounds of weight loss. So Gail, I'm sorry, I said Dan. It's Gail. Go back to the basics. That's why I did tonight's broadcast. Start at the basics and walk back through what's happening with you. Now, if you've done all those basics we talked about and you're still going, "It's not moving," then you got to see your doctor and get your thyroid checked, and you got to see your doctor and get your hormones checked. Those are the next 2 steps in the process, and I can't emphasize that enough. I've had to cut down my fat as I've lost a lot. And many of us do because we become more efficient at absorbing fat, and we find that we need to bring that protein level up to maintain the muscle mass more effectively, and that's what we do. Hi, Dr. Nally, we do the carnivore diet. I am 90% carnivore. I found that being about 90% of the time eating carnivore lowers my total carbs enough that I actually feel better, and I do better, and I'm able to maintain my weight much more effectively. Is the opposite true? I eat enough protein and twice the amount of fat. I'm still tired and losing hair. Then Donna, and I see this with a lot of people, they're pushing that fat to double, and that's way too much Initially, what we do is we give people we let them eat as much fat as they want when they first start because they're not fat adapted. And that helps keep them satiated and they feel good. And then by the second or third month, we've got to start backing that fat load down to roughly a 1-to-1 ratio. If you're doing twice the fat, the question is, if you're doing it by grams, you're way out of it, Mark, and you're not getting enough protein. Now, hair loss can be related to lack of protein. It can be related to poor sex hormones, so pregnenolone being too low, testosterone being too low, progesterone being too low. Those are a number of things that can cause that. So you may want to check with your doctor. But the challenge that I find is a lot of people are they think they're supposed to slather themselves in fat. That's not the case. Remember, it's a 1-to-1 ratio by calories. I'm sorry, by grams, not by calories. Gwen says, I love the info. Just when I think I know what I'm doing, you learn something. Well, I'm glad, Gwen. That's awesome. I'm glad you learned something there. Let's see. Brad says, hello. Hello, Brad. Will a keto diet help Tourette's? Well, Pauline, we know it helps schizophrenia. We know it helps depression. We know it helps anxiety. I have never seen a specific study looking at a ketogenic diet treating Tourette's, but we know that some of the factors and components in regards to anxiety, depression, and schizophrenia have used the same hormones that Tourette's does. So I've had a couple patients anecdotally tell me that their Tourette's seems to be better, but there's no study that I've seen on that. If there's one out there and I'm unaware of it, let me know. I'd love to know that. I have not seen one myself. Hello, Heather. How are you? All right. Hello, Jonathan from Brisbane, Australia. Wow, you guys are way on the other side of the world. Let's see. Hello from Orlando. Happy Doctor's Day. Oh, thank you, Patty. I appreciate that. Let's see. Hello from Tennessee, Gene and Tom. How are you? Let's see. Maryland. Connie says hello from Maryland. Awesome. Let's see. Thanks for the info today. Oh, you're very welcome, Mark. Hopefully that's great. Let's see. Hello from Dubois, Pennsylvania. I can never say that. Dubois, Pennsylvania. I think I'm saying that right. I can never get that word. Hello from Linda from Ohio and Barbara from Bama. All right, you guys. Any questions I can answer about this particular topic? A lot of people struggle with this topic. Let's see. Keto is great. Let's see. Oh, let me go to here. Let's see. Your Keto Essentials changed my clients' lives. Thank you, Monica. The Keto Essentials vitamin, some patients just don't get the balance they need. And I have about 60% of my patients are MTHFR deficient. So that methylated folic acid that's in there is essential for them. And so that's why it helps so many people, myself included. Let's see. I like eating the fat off the steak. Well, Brad, I leave the fat on my steak. And when you leave the fat on your steak, like you have a ribeye and I leave the fat on, that's 70% fat, 30% protein. Now, if you get a leaner steak, my wife prefers the sirloin or the fillet, which is a much leaner steak. You're not quite 70%. You're probably 65, maybe 50%, 55%, 60, 55% fat on those once you've cooked it. But again, if you're looking at a ribeye, that's roughly 70%, maybe 75. All right. If you're fat adapted and I've been keto for 2 years, how much fat would you recommend? Well, Kathy, again, I would go back to the basics. I would say calculate your protein need based on your height and physical activity level. And then for every gram of protein, you need a gram of fat. Now, let's say that calculates out to be 65, let's say 70 grams of protein and 70 grams of fat. And you do 70 grams of protein, 70 grams of fat, and you're still hungry, then increase it to 80 grams of protein and 80 grams of fat. And then if that doesn't, and you're still hungry, go to 90. Now, if let's say you're at 80 grams of fat and you're now full, but you're not losing weight, then every other day, instead of doing red meat and pork, do chicken every other day. And that brings your total over a 3-day window down a little lower to maybe 30 or 40 or 50% fat and a little higher protein level. And then you should see weight loss in that way. And that helps people find that magic spot for them based on their degree of insulin resistance, how much protein they can handle, how much muscle they have, and how much fuel they need to stay full. Does that make sense? I hope that does. All right. Ed says keto is great. Yes, keto is great. And Kathy says if one still wants to lose fat, related to the other question I just answered. Just received my book today. Well, Robin, read the book, and I'm curious to hear what you think. You're pre-diabetic and overweight, 66. So it works wonderfully well for pre-diabetes. Kathy from Pennsylvania, hello. Does caffeine give high blood pressure? Well, excessive amounts of caffeine can. So if you're doing more than 100 grams of caffeine in a 4-hour window, yes, it will raise your blood pressure. I'm in Reno, Nevada tonight. Oh, well, hello, Gwen in Reno. Wow. I think you're a ways away, aren't you? Let's see. Hello, Karen. How are you? And happy Doctor's Day it says Michelle. Thank you very much. Du Bois is the right. Okay, that's how you say it. Thank you for that clarification, Lynette. I appreciate that. Eating liver and vitamin A toxicity is eating liver. So there's no chance of vitamin A toxicity eating liver. No, you're fine. You can eat all the liver you want. That's a misnomer. Let's see. Got my book. It's great. Thank you, Betty. I appreciate that. How is HOMA IR test done? If it's done by a clinic, are they needed and are they expensive to have done? Well, usually the HOMA IR test is an insulin resistance score calculated between your triglyceride levels and your HDL. And that helps a person understand where they're at in the insulin resistance level. Now, it's not a bad test, but I don't rely on it. What I find is that if your fasting insulin's over 5, you're insulin resistant. If your triglycerides are over 100, you're insulin resistant. If your small dense LDL particle on an NMR or a cardio IQ test through the lab is greater than 550, I guarantee you're insulin resistant. If your waist as a male is greater than 40 inches, you're insulin resistant. If your waist is greater than 35 inches as a female, you're insulin resistant. If you have skin tags on your body anywhere, you're insulin resistant. That's how we know. Hopefully that helps. All right. Julia says, happy Doctor's Day. Thank you, Julia. Thank you, Paula. I appreciate that. Let's see. Eating liver and vitamin A overdose. Is this possible? Are you taking extra vitamin A, Claudia? I wouldn't. If you're eating a lot of liver, I would not take extra vitamin A. You can overdose vitamin A, yes. So I would not do mega doses of vitamin A and liver at the same time. Liver will give you plenty of it. Let's see here. Perfect. Oh, I pronounced it good. All right. Thank you. I have to take AREDS for macular degeneration. So would taking vitamin B too much? Yes, there can be issues in the B vitamins being toxic in that regard, Nita. So you would want to figure out how much of those B vitamins they want you to have and see if there's enough in my vitamin or vice versa. During your breastfeeding, would you recommend higher protein? Yes, I actually would. Remember, breast milk is ketogenic. It's 80% fat, roughly. Depending on what mom eats, but breast milk is ketogenic. The baby is in keto when he or she drinks breast milk. Breast milk is for mom is ketogenic. You've got the baby and the baby's growing. So doing a ketogenic diet as a breastfeeding mother, as long as you're getting adequate protein and fat, you'll do wonderfully well. A lot of people say, I'll lose my milk. You only lose your milk if you do it wrong. So you need to be eating adequate protein and fat. I haven't lost any weight since postpartum. Do I find this typical? Well, I find it typical if your diet is off. So yes, and if you're insulin resistant. So I would have to look closely at your diet, what your physical activity levels are, how often you're breastfeeding, all those kind of things. Eating liver and vitamin A overdose. So I think I answered that one. All right. Hello, Dr. Nell. Hey, Terry, how are you? Okay, we'll do cut back on one cup of green tea and 1 cup of butter. I would cut out all the green tea, because green tea will spike your insulin for up to 12 hours. So I would do no green tea, because green tea has a tannin that raises insulin all by itself for the next 12 hours. And a cup of butter. Again, I would avoid drinking your calories if you can. How can you be insulin resistant and have a good A1C? Because insulin resistant is not related to A1C. Your A1C, all it says is what your average blood sugar has been for 90 days, when the red blood cell is born. The red blood cell is born essentially with a sugar thermostat that says the blood sugar today was, and so if your blood sugar was 115, that protein level is at a certain amount on the red blood cell. And then we know that red blood cells live on average 90 days. And so when you average that protein amount in that set of blood samples, you get an average blood sugar based on those proteins present. That's all it says. You can still be insulin resistant. You can still overproduce insulin in response to starch and sugar, but be controlling your blood sugar quite well. I have multiple patients that their A1C is 5.6, which is normal. But if I look at their fasting insulin, it's 20. And their cholesterol is high and their triglycerides are high. But my blood sugar is fine, Dr. Nally. Yeah, but the inflammation is through the ceiling because your insulin's still high. Your insulin's high because it's trying to keep your blood sugar under control. So relying upon the A1C to say everything's good in the world, all it means is that your insulin being excessively high is keeping the blood sugar good in the world at that moment in time. I hope that makes sense. Let's see. What number do you like blood sugars at in the morning? I'd love to see them less than 95. Thanks for all your help. Oh, you're welcome, Teresa. All right. Do you recommend drugs like Ozempic and Trulicity for insulin resistance? I don't recommend them for insulin resistance. I recommend them to treat the blood sugar if the blood sugar is high in patients who are, remember, insulin resistance is the underlying cause of diabetes. I usually don't treat with those medicines unless we're treating true diabetes. Now, there are some cases of weight that we're using Ozempic for and things of that nature, but those are being used off label. But I don't just give those to people because they're insulin resistant, because they can actually have some side effects if you don't need them. And so those are some things you don't want to do. Thank you for another night of good information. You are welcome, Vicky Hart. Thank you for the A1C explanation. I hope that helped, Kathy, and I hope that wasn't patronizing. Some people think I'm angry at times. I'm not. I'm just excited about it. All right. Anyway, that's the story. Great questions, you guys. If you have any other questions, let me know. Hopefully that explains the protein issue. So I'm going to just summarize one last time. For those of you that decided to jump on here, keep the carbs under 20 grams per day. See if it'll pull up here. Maybe it will. Keep carbs less than 20 grams a day. That's total carbs. Get your protein to fat ratio less than 1-to-1 or 1-to-1 or so, roughly. Don't drink your calories. Like Dan was talking about, a cup of butter in your coffee. That's not a good thing. And avoid foods that spike insulin, teas, sweeteners, things of that nature. Be careful with those. Be careful with the nut flours and the nut milks. I don't know very many people who milk the nuts very often, but nut milks can be excessive. So be careful with those. And amazingly, even though the nut flours are fermented in the gut, some people still derive some starch and sugar out of that. So be careful with that. You're just passionate about your work. Yes, Debbie, I am just passionate about the work. Off subject. Let's see. Question, please. If you have had pneumonia vaccine and contract coronavirus, is it less likely to be severe? Pneumonia vaccine is pneumonia. The bacterial pneumonia is a completely different entity than the viral RNA coronavirus. Two separate issues. There is no relationship there. Can the dawn effect be a sign of insulin resistance? Absolutely, it can. It is a classic sign of insulin resistance. Do you take your blood sugar and divide it by your ketone level, Dr. Baugh's method? I do sometimes, Teresa. I've found that if I'm trying to treat epilepsy or seizures, that is helpful. And I know that Dr. Baugh loves to use it, and I found that it's fairly helpful in many cases. But I find that if you're tightening up your carb intake and you're doing a more natural, truly ketogenic diet, that number actually, Dr. Baugh's number actually becomes more normal and within range. So I don't use it all the time. Occasionally I'll use it, but I've not found it to be that essential for a lot of my patients. You got another nugget tonight. Thank you, Mark. How do I reduce mucus? You do keto. It stops the allergy production. All right, I'm glad that I am a loser. I lost my fatty liver, lost my high blood pressure, lost my 90 pounds, lost my seatbelt extender. Oh, those are awesome things to be a loser over, Dennis. I love it. Do you take your blood sugar and divide it? Oh, I already answered that question. All right. I think I got all the questions, guys. I think dinner is done at my house. I can smell the yummy hamburger in the background. So I think I shall sign off unless there are any other burning questions. Kathy said this was very helpful. Thank you. I'm glad, Kathy. I'm glad that it gave you some help. If this helps, share it out, please. Click the subscribe button right there on YouTube, because this is going to roll to YouTube, or go over there and click the subscribe button to Dr. Adam Nally on my Facebook page, so you can actually get notified. And if you like this and you want to get a copy of my diet, go to docmuscles.com and check out the diet, or go to my Keto Clan group and join the Keto Clan, where we've got 13 modules that talk about all this stuff at length, and there are PDFs that you get to print out, and you get some videos you get to watch. And it's actually it's a Facebook group that's private that I do other videos in and stuff like that. That's actually pretty cool. Paula has lost 64 pounds using my book. Thank you, Paula. That's awesome to know. Thank you very much. Ketones in the blood. I check ketones in the blood. Yes. Is that what how bad is cheese? If it's hard cheese, I'm not worried about it. If it's Velveeta or American cheese or cottage cheese, I would avoid it like the plague. All right. Is my book on Kindle? Yes, it is, Rob. It is on Kindle. Thank you. You are very welcome, Marianne. The name of the book. I guess that would be helpful, isn't it? Go to Amazon and get The Keto Cure. Or you can go to docmuscles.com and order it online, and I will send you a signed copy of the Keto Cure. This is my book. I wrote the main text. Jimmy Moore put the sidebars in for us and did a bunch of comments to help bring the technical stuff into more of a layman's term. And then Maria Emmerich did 60 of the best recipes she's ever done in the book. I think they're the best recipes, but she did a fantastic job of them. So those are my two other co-authors that helped write the book with me. Is it on Audible? Yes, it is. It's on Audible, Kathy. Let's see here. Okay, levels of ketones, somewhere between 0.8 and 1.5 is where I shoot for in the blood. All right, guys, I am going to sign off. Have a great evening. I'm going to go get dinner. You guys have a wonderful day. Wash your hands. Stay away from sick people. And remember, keep the fat high, keep the carbs low. Pass the bacon. Have a good night. Bye-bye.